Hello, I'm Dr. Mitchell Haut, and I am one of the medical oncologists here at Mercy Medical Center, and I've been the senior investigator of clinical trials at Mercy Medical Center as well for over 20 years. There are several things that make cancer care at Mercy deserving of special recognition. This is a facility that's large enough to have all the essential specialists for cancer care well represented, yet still small enough that we all know each other very well. That facilitates collaboration between the various specialists in charge of various aspects of a patient's cancer care so that they can all be coordinated in a seamless fashion to drive optimal cancer care outcomes. We have a very congenial working environment here, and this is what helps make it all happen. I find that all of our physicians and other staff willingly and enthusiastically participate in all of our various committee meetings in which we continuously evaluate our outcomes so that we can improve the patient care experience and drive optimal results. Some of the things that also have helped drive excellent outcomes have been the willingness to adopt what have become commonplace practices very early. Mercy was very early in adoption of the concept of using nurse navigators. We decided to involve our nurses who have extensive cancer care experience to help patients navigate through the complexity of modern cancer care, which often involves multiple specialists, multiple procedures and tests, all types of therapies, and it all has to be done in a short time frame. And it can be overwhelming for patients. And these nurse navigators help get them through this whole experience. They serve as a resource. And this helps patients stay on task and stay on track and stay on schedule. And this is all very important in getting the cancer treatment necessary to win the battle. At Mercy, we instituted early adoption of the guidelines of the National Comprehensive Cancer Network. These guidelines for cancer care are continuously updated and serve as the foundation for what we do and how we make decisions. They have had broad applicability and broad physician and professional uptake. These guidelines are now universally accepted as being one of the finest sources of cancer care information. Mercy has made a long-term commitment to participation in clinical trials. These are trials of the newest therapies in cancer care. Many of these trials involve chemotherapy, hormonal therapy, targeted therapy, immunotherapy, surgery, and radiation therapy. We have provided patients access to clinical trials of new cancer therapies even before they were commercially available. The results of these clinical trials have led to the current focus on personalized medicine in cancer care. Certainly one may choose a more famous place, but you won't find a more dedicated team of cancer care specialists anywhere else. So here at Mercy, we have targeted lung cancer as one of the more common cancers that requires really a team-based approach. What was once simple and straightforward to take care of lung cancer, which meant mostly surgery, has now become one of the most complex types of cancer to take care of. Modern lung cancer care involves the collaboration of the primary care physician who's involved in the initial diagnosis and often in the supportive care of the patient along the way. It involves the participation of the pulmonologist, thoracic surgeon, pathologist, radiologist, medical oncologist, radiation oncologist, and a variety of additional practitioners who all participate in the care of these patients. Somehow we have to get all of these people on the same page for every patient. It takes a lot of collaboration to make it happen and achieve the optimal outcome. So we have regularly scheduled meetings about these patients in which all of the participants come together and review each case together in a collaborative environment. These meetings help coordinate the care for each patient, and through the interaction of the various specialists, we can bring different concerns to the table as to what may be a particular benefit or a particular risk based on the details of a patient's history and health status. And by coordinating our thinking on this, we can in turn coordinate their treatment so that things happen in a rapid sequence to achieve optimal cancer outcomes. When it comes to the lung cancer program at Mercy, really the driving force is the nurse navigator. Our nurse navigators coordinate the entire lung cancer treatment continuum, from screening and diagnosis of lung cancer all the way to palliative care and hospice near the end of a patient's life. And the nurse navigator helps facilitate everything that comes in between. Often this involves patients having to digest vast new amounts of information that they're completely unfamiliar with. And that nurse navigator serves as a resource for those patients and those families with that understanding that patients can most effectively help drive their own cancer care. With the one-call line, the patient is referred directly to the nurse navigator, who can then help coordinate all the visits and all the other professionals that have to be involved in delivering that patient's care, both in terms of patient evaluation and in the actual patient treatment. This simplifies the process so that the referring physician doesn't have to figure out which subspecialist that they should send the patient to. They can send the patient to one place, and with that nurse navigator's experience, she knows who needs to see the patient next and in what sequence. The nurse navigators recognize that the primary care physicians play a vital role in the whole process. We know that patients are going to go back and turn to their primary care physician for validation and guidance. We know we have to keep the primary care physician up to date on what's going on so that the primary care physician can help be supportive of what the patient chooses to do or needs to have done. One of the finest examples that I can remember of what makes Mercy's cancer program special is a patient that I had several years ago with esophageal cancer. Now, this man also had heart disease and required the care of several specialists to get his treatment started. So he went to a tertiary care facility in another city where he saw a cancer specialist and was referred to a pulmonary specialist and a heart specialist and a surgical specialist and a radiation specialist, and had to drive back and forth. After close to a year, he still had not started his treatment. One specialist needed the input of the next specialist and the next specialist, and he never actually got started on treatment. When he came to see us here, I saw the patient, telephoned his cardiologist, who I know quite well, and together we decided on what might be the best treatment for him. Within a few weeks, he was started on chemotherapy and radiation therapy, and proud to say that through the hard work of his various specialists, we actually achieved a cure in this individual. He lived for close to 8 years afterwards, which is rather unusual in esophageal cancer, and he eventually succumbed to his heart disease. 4 awards that Mercy has won puts Mercy into an elite group of hospitals and cancer centers that provide consistent, high-quality cancer care to patients with a variety of cancer ailments. Doesn't mean we take care of every single type of cancer there is, but what we do quite well, consistently. Here at Mercy, we help people face what could be the worst, most frightening and stressful experience of their lives. We start with fear and pain, and we try to replace that with hope and comfort.